Hello and welcome, listeners, to episode 2 of the COVID-19 series. Today, we take on an economic and financial perspective of the crisis, and to help us better understand the various dynamics we have with us, our guest, Dr. Sue Horton, is going to help us out. Dr. Sue Horton is a researcher at the University of Waterloo with a specialty in economics, graduating from Cambridge University, Harvard University, and Harvard University again for her bachelor's, master's, and PhD in economics, respectively. Her work is centered around the economics of global health, where she is focusing particularly on the economics of diagnostics. Presently, she is also the deputy chair of the Lancet Commission on Diagnostics. Thank you for taking the time out to join us today, Dr. Horton.
My pleasure.
Great. I think let's just dive right in. Dr. Horton, based on your understanding, we've all been watching the news. You know that the biggest sort of issue that's troubling us right now is diagnostics with COVID-19. We know many countries are struggling to not just identify new diagnostic methods, but also administer them to their populations. Like we see the FDA is coming out with new diagnostic measures, and Health Canada is constantly appropriating trials for new concepts. So what are your thoughts on the economics of diagnostics, especially during COVID-19? And what do you think that we're doing right and some things that we could be doing a little better?
Okay, so my own focus is mostly on the low and middle income countries, but let me start out with a short story that I read in one of the US magazines about a woman in New York City in the early phases of the pandemic, when it was really, really hard to get testing. So she tells this harrowing story. Okay, it does end, I'm telling you, it does end well. Her husband did survive, of how, on the one hand, she's hearing on the TV, oh yes, we have lots of tests. Tests are really available. And on the other hand, she could not get her husband tested. And the day she finally got a phone call offering him a test was the day he was on life support in hospital for COVID. And then she herself eventually got tested, but the whole process was very traumatic. So I think COVID has underlined the fact that we have not emphasized diagnostics enough. So let me at the outset define what I mean by diagnostics. So the big ones that we are looking at would be laboratory medicine, okay, and COVID would fit into that, plus pathology, which is used for things like cancer, and then also medical imaging. Okay, but today we'll focus mostly on the lab medicine since that's the most important for COVID. So if anything, diagnostics in general tend to be overused in the high income countries, but underused in the low and middle income countries. And let me explain why they're underused in poorer countries or for households that don't have good health coverage. So here's my example. So we have a dog, we take him to the vets, and every year the vet says to us, oh, you're going to need these heartworm medication, but really we should spend $150 on blood tests first for your dog before we administer the medicine. So you always have to think really hard about that because dogs aren't covered by health insurance. And
Sure.
Lots of people will say, I just can't afford the $150. He's going to need the heartworm tests anyway. Let's just give the medication. Okay, and that's what happens in a poor country when the mother takes her child to the health facility. And it's the same for malaria. The mother says, I'm pretty sure my kid has malaria. He's had it before. I know what it looks like. And she can't afford to get a proper malaria test. So the doctor just prescribes the malaria prophylaxis, or she just goes and buys it in a pharmacy. Okay, and why is that bad? It's bad because that's the recipe for antimicrobial resistance, which we know is another really bad trend that's occurring worldwide. That we overuse antibiotics because we don't do the tests, and therefore we get all these antibiotic resistant strains. So I guess my bottom line is that in the poor countries, universal health coverage is an enormous goal, but it will not be achieved sustainably unless we put more emphasis on diagnostics.
Wow, for sure. I think as you mentioned, I mean, a lot of the lower income or even the middle income countries are really struggling with being able to have at least the masses or the vast majority of their public just go out and get a lot of these tests done. And I think your discussion, your answer to this point sort of segues perfectly into our next topic of discussion, which could be um, how do you think we can sustainably lower diagnostic costs? So, is there a way that you think that we could do this in particular for COVID-19, or even out of COVID-19 for the next big thing, or just typical diseases? Do you think there are some sustainable methodologies that we can adopt to significantly lower these costs and make diagnostics more available to everyone?
Yes, I think that's a great question. And I think there are things that we can learn from how pharmaceutical prices have been driven down over time. You just have to think about the HIV/AIDS epidemic and the movement that has made antiretroviral therapy more affordable. So for diagnostics, they are primarily produced in the high income countries. For the Lancet Commission on Diagnostics that I'm working on, we have done an analysis of the global market. And essentially, for diagnostics, they are, more than 95% produced in high-income countries. So the kinds of diagnostics that are available are more suited to high-income country epidemiology, and also they can charge higher prices. Now, for pharmaceuticals, what happened is that India became what's known as the pharmacy of the world, that they produce more generic drugs at lower prices, which they target to the lower middle income countries. And whereas we buy our drugs from the, Roche and Sanofi and Johnson & Johnson, which are located in the high income countries. So I think that's one issue. We need to encourage more production of diagnostics in the lower and middle income countries themselves. And a bit of that's already happening. A lot of the point of care tests for COVID are produced in China, for example. And of course, the big issue there is quality. You don't want a low cost test to be a low quality test, because that's not a useful test.
For sure.
So that's a big issue. So that's one of the ways that we can make it more sustainable. And secondly, I mean, there are obviously campaigns on reducing price. So Treatment Action Coalition, which was very involved in reducing the price of antiretrovirals, is also campaigning on the cost of diagnostics. They have a $5 a cartridge campaign on their website. So just to back up a little bit, some of the molecular diagnostics, which are very rapid, are quite expensive, but they can be done, with relatively little laboratory equipment. You have a little box. There's a gene expert, for example. You put into it a cartridge, and then, within 15 minutes, you get a result. But these costs are really expensive. The cartridges usually cost $20 per test. Okay, and that's what Cepheid, the manufacturer of Gene Expert, is charging for the COVID test. Okay, nobody in a developing country is going to be able to afford $20 for a test. So the Treatment Action Coalition is campaigning to reduce the price of these to $5, arguing that, in their opinion, the manufacturers are making excess profits. Okay, so that's another line of attack to try and make diagnostics more affordable. Okay, and then lastly, let me mention something that's called pooled procurement. It's where, rather than individual little countries or counties within each country tries to go on the market and buy the diagnostics individually, they use the power of the combined buying power of a pool of countries to negotiate better prices. They're negotiating with these huge multinational conglomerates, and they can get better prices, by using the market power of buyers. Okay, and that's been something that's been successfully used in pharmaceuticals, and organizations like the Global Fund have helped countries to do this and to get better prices. And so that's another possible solution for diagnostics.
Wow, that sounds very interesting. And I think it's really interesting that you mentioned that a lot of these methodologies, such as the latest one that you just mentioned about the global fund, I think a lot of these aren't necessarily something that's difficult to do. Yes, obviously there's like political barriers, but it's not sort of like a new sense of technology we need. It's just about rearranging the resources that we already have, which I think is really, really interesting. And just to move on from here, now that we know what we could do and why lowering costs is so important on an international scale, presently, how do you see healthcare economics changing in terms of their dynamics? We know that because of COVID-19, some countries have offered free healthcare, diagnostic costs have gone down. For some countries, namely for many of the lower or middle income countries, the healthcare burden on their systems has been far too intense. So coming out of COVID-19, how do you think the economics of healthcare overall on an international level are going to change? And what do you think can be done to mitigate those changes to reduce adversity for global health?
Okay, so let me give 3 or 4 examples. What I'm going to start out with is the newest test for COVID-19 that is being produced in Senegal for $1 a test. So here, foreign aid money, I think it was the UK in this case, made an effort to do local production for Africa, within Africa at a price that Africans can afford. I think that's an excellent way to go. So that's one thing.
Wow.
Secondly, I don't know if you were following the World Health Assembly that met virtually this week, but one of the initiatives they came out with was a resolution on a voluntary intellectual property pool for COVID. Okay, so that's not just for diagnostics, but it's also for vaccines and for treatments. So as you may imagine, most of the countries signed on, but the big pharmaceutical manufacturing countries had conflicts of interest. The US declined to sign some of that resolution because they house all the a bunch of the they house a bunch of the multinationals in the US, and the multinationals want to protect their IP. So the US is conflicted. But for most of the rest of the world, I think that's going to be a really important initiative, and I think that's going to be great going forward. You know, this is public health, and we need public ownership of the intellectual property, particularly because governments have invested billions of dollars in these technologies. Okay.
Fair enough. Totally.
Yeah. So a third thing I'll mention is an interesting initiative at the World Health Organization. There's something called the Essential Diagnostics List. Okay, and they are currently doing the 3rd edition of that. It just started 2 years ago. And you may know about the Essential Medicines List, which has been going for the last 40 years. And this essential list is a way of prioritizing, you know, saying what's really important and hence trying to drive down the prices of those drugs, you know, as opposed to the pharmaceuticals that are not as essential, you know, or are nice to have, but not must have for the country's medical system. And then the last initiative I'll mention is, you may have seen a couple of organizations mentioned during the COVID pandemic. One's called CEPI, the Coalition on Epidemic Preparedness Innovations, and the other's called FIND, the Foundation for Innovative New Diagnostics. So these organizations existed prior to COVID. I mean, the CEPI was in fact preparing for future pandemics. And so these organizations can help innovate for new diagnostics. They can help particularly small companies in low and middle income countries to get a toehold in the market. Both of them work in India, for example. And I think, again, those are going to be key ways going forward that we can think about, you know, future health needs and future pandemics.
Perfect. That sounds wonderful, and it's really good to know that there are organizations that are striving towards lower diagnostic costs, because as you know, health data is the foundation of what we do. I mean, if you don't have particular health data, it's impossible to clinically operate on a patient or even a whole population. And just building off of this discussion, based on lower diagnostic costs and how we're sort of striving for that, how do you think these changing dynamics will be affecting the success of our sustainable development goals in the next, let's say, 10 to 15 years?
Yeah, so great question. So one of the important sustainable development goals is universal health coverage. And to me, that's a tremendously important goal. So the sustainable development goals, are a sea change compared to the Millennium Development Goals. Jim Kim at the World Bank called the shift from billions to trillions. That the Millennium Development Goals were ambitious, required billions of dollars, but the Sustainable Development Goals require trillions. But given the disruption that the COVID pandemic is causing globally, I think it's going to make it harder for us to reach the Sustainable Development Goals. The Millennium Development Goals were tough enough. There were 8 goals with 29 targets, but the Sustainable Development Goals have 17 goals and 169 targets. Okay, so as an economist, I'm very used to having to make priorities, make trade-offs. What's the most important? Whereas the sustainable goals look a bit like something for everyone. Everyone who was invited to suggest something, put something in, and then you end up with a whole smorgasbord of people's wish lists. So I think COVID is a wake-up call that we're going to have to prioritize. We aren't going to have the money to do everything right away. And personally, I think universal health coverage is going to be an enormous priority. And I hope that the work of our Lancet Commission is going to underline the importance of diagnostics as part of universal health coverage.
Wow, certainly. I think just from this discussion we've gathered just how important diagnostics is, and absolutely once universal health coverage does spring to life, diagnostics is going to be a big component, especially when it comes to offering these services for free. So with that being said, Dr. Horton, I think we are just about at the end of our time. So I'm going to start wrapping up the session now. Just if you have any final concluding statements, the floor is yours.
No, I'm just happy that you've addressed this topic and given me the opportunity. And if people have feedback, I would love to get it. You can find my email on the University of Waterloo website. And if you want more information, our website for the Commission is diagnosticscommission.org. And we also have a Twitter feed at Diagnostics Commission. And, thanks for inviting me today.
No, it was great to have you. I'll make sure I'll link those in the description so our listeners can find those links attached. And with that being said, I think we really gathered how important diagnostics is just for our system. We've understood how I think COVID-19 has done a great job in highlighting how important it is. And we know that for the coming future, reducing these costs and hopefully making it universally accessible for everyone as per our SDGs will be a huge priority. So with that being said, thank you so much for your time, Dr. Horton. And this is episode 2 out.